Good afternoon, everyone. My name is Mary Beth Carroll, and I oversee our recruitment and admissions team here at the University of Michigan School of Public Health. We're so happy that you're here. This is our second enrichment session of our four-part series, and it's titled Distinguish Yourself. And it really will talk about the interdisciplinary opportunities here at the University of Michigan and within the School of Public Health. So we're really excited to talk about that today. Specifically, we'll be talking about a general overview within our dual degree programs, as well as touch on some of our certificate opportunities for our current student population as well. And of course, as prospective students, hopefully you have all of these things in mind, and our hope is that you'll be able to really envision yourself as a current student and someone who's able to contribute to our community after today's session. I do want to note that we do have both residential and online prospective students logged in today. If you do have specific questions regarding your situation, please feel free to let us know in the chat where you've just been interacting. In addition to that, though, please feel free to reach out to our team afterwards through our SPH-inquiries email account, and I will throw that in the chat in just a moment. We'll do our best as a team between Kathy, Mike, and myself to get through all of your questions and field them to the best of our ability. If we don't know the answer, we will be sure to point you in the right direction. And with that, I am joined by two colleagues today. They'll be leading today's session, and they truly are the experts. So you are in good hands. And this is our registrar team, which is led by Kathy, who is our school registrar, and Mike, who's been a wonderful addition to the team as well, who works as our student services coordinator. So with that, I will turn it over to both of them. Thanks so much.
All right, thank you very much, Mary Beth. So I'm going to start this off. As Mary Beth mentioned, the University of Michigan School of Public Health promotes and encourages an interdisciplinary learning environment. So this session, we're going to provide basic foundation information for you for students who are interested in augmenting their main degree program with either a dual degree or a graduate certificate. Topics will include available dual degree programs and certificates, timelines for next steps, and contact information for continued conversation. So first, I'm going to just take a second to introduce myself. As Mary Beth said, my name is Kathy Hastings. I'm the registrar here at the School of Public Health, and I'm here to answer any questions you may have about things like academic policies, our programs, academic requirements, registration questions, and anything really about your student record. I'm going to talk to you today about some of the dual degree options we have here at the School of Public Health. I'm not going to focus on specifics of each of the duals that are offered due to time. However, there will be contact information throughout the presentation. So if you see something you're interested in, you'll be able to get more details as you finalize your decision. First, I want to start off by telling you some fun facts about the School of Public Health. We're ranked as the #4 School of Public Health in the nation by US News and World Report, and also as the #1 public research university in the US by the National Science Foundation. We offer our students 7 formal dual degree options, as well as a self-initiated dual degree option. So you may be asking yourself, what are dual degree programs? Formal dual degree programs are written agreements between 2 U of M schools. Why would you pursue a dual degree? Well, students who elect to do this can earn 2 degrees simultaneously and in less time than it would take to pursue them separately. This leads to 2 different degrees listing on your transcript and 2 separate diplomas. Students pursuing a dual degree will work very closely with their program coordinator here at the School of Public Health and their coordinator or advisor at the other school to be sure they're staying on track and in time to complete both degrees. In order to pursue a dual degree, you have to apply separately to both programs. And you have to meet each school's entry requirements and standards of admission. Acceptance into one side of the dual degree does not guarantee acceptance into the other side. This can be done either before you begin here at the School of Public Health or during the first year of your program. Applications to the MPH or MHSA side of the dual degree are done through SOFIS and have a priority deadline of December 1st. Applications to the MS side of a dual degree are done through the Rackham Graduate School. Application requirements and deadlines for the other schools in these programs can be found on their individual websites. So the first set of duals I'm going to talk about are from our HMP department, or Health Management and Policy. They offer 3 formal dual degrees, and they are also ranked as the #3 Health Management and Policy program in the US by US News and World Report, another fun fact. They offer a dual Master of Health Services Administration or a Master of Public Health and a Master of Business. This dual is really designed for students who want to further enhance the business skills provided through the MBA curriculum with a health management and policy focus. This is designed to be completed in 3 years rather than the 4 years it would normally take to complete both degrees. They also offer a Master of Health Services Administration or Master of Public Health and Juris Doctor. This dual enables students to pursue concurrent work in either Healthcare Services Administration or Public Health Law, along with their law degree studies, and it's designed so you're able to complete both degrees in 8 terms of enrollment. And finally, their last formal dual degree, they offer a Master of Health Services Administration or Master of Public Health and Master of Public Policy. This dual is ideal for students who wish to advance their training in the quantitative and qualitative methods of policy analysis, as well as getting thorough preparation in health management or public health policy. It's also designed to be completed in 3 years. In addition to the formal degrees, the HMP department offers a variety of other informal dual degree options. You can find more details about the formal and informal dual degree options available through HMP on their website. It's listed here. And I think Mary Beth was going to put that in the chat for us. Now we're going to move on to our Health Behavior and Health Education Department, also known as HBHE. They offer one formal dual degree program, a Master of Public Health and Master of Science in Genetic Counseling. This dual provides students with an innovative learning experience that includes academic training, research skill development, and clinical instruction, and focuses on addressing issues that occur at the intersection of the fields of health behavior and health education and genetic counseling. Their goals are to promote health, prevent disease, and manage chronic illnesses, to understand the genetic basis of common complex diseases, to help individuals and families adapt to the implications of genetic contributions to disease, to understand the impacts of genetics on health, and to guide the evolving practice of genomic medicine and public health genetics. They typically only accept 1 to 2 students per year due to the small class sizes of the genetic counseling program, and it's also designed to be completed in 3 years. You can find out more details about the formal dual degree through HBHE on their website, linked in the chat now. The last dual degree I'm going to discuss in some detail is our Master of Public Health and Doctor of Medicine degree. This dual is not housed in a specific department like the others I've discussed so far, but most of the students participating in the dual are either from HBHE, HMP, or epidemiology. This program is designed for students who want to combine their medical degree with a public health degree, and it is suitable for students interested in community medicine, health behavior and health education, healthcare management, healthcare or public health policy, epidemiology, environmental health sciences, nutritional sciences, or for students who simply want to enrich their medical education with an emphasis on public health. In order to be eligible for the program, you must either be currently enrolled in an accredited MD program, or be employed in your medical residency, or be in a medical fellowship. The structure of this dual is slightly different. The MPH part of the program is done in 1 academic year, which includes the fall, winter, and spring, summer terms. Generally, students take a leave of absence from medical school between the 2nd and 3rd year to complete their public health coursework, and then return to medical school to finish their MD. The MPH is awarded once the MD degree is finished and awarded as well. You can find out more details about this program on our website as well and through the link in the chat. And the last option, dual degree option I'm going to discuss is our self-initiated dual degree option. We offer a self-initiated dual degree option to our students. These degrees allow the student the ability to complete 2 different degree programs tailored to their particular interests and are also usually done in 3 years. Like with the other dual degree programs, you have to apply to each program separately and must apply within your first year of study. There are 2 different options available for self-initiated dual degrees. One is for students earning 2 degrees in the School of Public Health, and one is for students who are earning a degree with the School of Public Health and a Rackham program. Students must choose which option they're going to do when they request the self-initiated dual, and will complete a form on our website upon entering the dual. More information about the self-initiated dual degree option can be found on our website and through the chat link as well. And if you need any more information, these links have already been shared, but you can also email us at sph.registrar@umich.edu. Any questions regarding the degree program should initially be discussed with the program coordinator of the department who offers the dual. And you can also feel free to email me or stop into the Office of Student Engagement and Practice and talk to me in person. And I am going to turn it over to Mike for the residential public health certificate programs.
Thank you, Kathy. I'm excited to be here today to talk to you about the graduate certificates. As Mary Beth said earlier, my role is student services coordinator, and I'm kind of the confluence for the certificate programs. I work with all the faculty leads. I handle all the inquiries. I advise students, conduct audits, and update all the websites. Can I have the next slide, please? So we have 6 graduate certificate programs for our residential students. These are designed to be added without completing any additional credits, degree requirements, or any additional costs. So why would you want to get these? You get to work with our distinguished faculty in their areas of expertise. You get to further specialize in one area, which allows you to stand out to employers. At the end, you will receive an additional diploma in, like you get an MPH, and you'll also get a certificate diploma. So it's really a wonderful opportunity. Now we're going to go through and talk about in a little more detail each of the programs. The first one is CHIP. That's our Certificate in Healthcare Infection Control. This provides students with the knowledge and skills needed to work in surveillance, clinical microbiology, and infectious disease epidemiology, injury sciences, urgent injury issues through research, education, and outreach. Topics included safety, violence intervention, prescription drug misuse, substance abuse, and concussions. This is a very popular one with our HVHE students, but I also would like to note that regardless of your department, all of the certificates are open to any student in residential. If we can move on to public health genetics, please. This is one of our very popular ones with our EPID and biostat students. This features interdisciplinary training that provides students with knowledge and skills required to apply advances in genomic science and improve population health. On to risk sciences, please. This one is a very popular with our environmental health science students, and also offers a lot of courses outside of the School of Public Health. It prepares students for increasingly complex health risks in a rapidly changing technological, social, economic, and political landscape through science-informed and socially responsive decision-making. We're going to move on to global public health. This is a great track for departments that don't already have a global track within their department. A side note to this certificate, the Office of Global Public Health designed it, and it's a great resource if you're interested in global internships. It's not required for the certificate, but people who are in the certificate receive preferential placement, and it's very, very popular and a wonderful program. Move on to social EPID. Okay, this is our newest certificate, and another little side note, it was designed by a student. And it's our most popular certificate now. You'll develop interdisciplinary skills needed to understand and address ways social factors influence population health and health disparities. Next slide, please. Where can you learn more? Please visit our website. It's wonderfully designed. I can't take credit for it. Someone else did it for me, but it really has a wealth of information on the individual certificates, different programs, the courses offered, all the faculty involved. So I highly encourage you to visit those resources. Next slide, please. All right, you're interested, what now? First of all, join us at the University of Michigan. We have a great program, and we look forward to hopefully seeing all of you in the upcoming years. When you do join us at the beginning of the year for each different certificate, we have an info session led by the faculty program manager that goes into much greater detail what each of the certificates entails and what you can hope to learn and apply from those certificates. After you have chosen that, you'll plan our path with us. You'll complete an intent to do it. You don't have to apply separately. You just let us know. And then when it's time to graduate, you'll receive our certificate from us. And that's all I have. Thank you for the opportunity. And I look forward to hopefully seeing some of you in the future.
And I will now discuss our online public health certificates. These certificates are only open to students in our online population and health sciences MPH program. So students in the University of Michigan School of Public Health, online graduate students in the population health sciences MPH degree program have the option to earn graduate certificates in a variety of specialty areas that help them dive deeper into their passions and support their career ambitions. Michigan Public Health currently offers 9 graduate certificates, which are available to students enrolled in the Population Health Sciences Online MPH program. Students in this program select a number of elective courses to meet degree requirements. As they work towards completing electives, students can choose to earn a certificate whose requirements are fulfilled by completing a series of electives in a particular discipline. Certificates are earned through the completion of all courses within a given certificate elective series. Elective series are designed to build expertise in a given area, such as applied epidemiology or healthcare accounting and finance. Completion of a certificate series denotes a depth of knowledge obtained by a student in a specific discipline. So the first one I'm going to talk about is our Analyzing Health Data certificate. This certificate is for students, students in this certificate will gain a basic understanding of study design, data analysis, and a deeper appreciation of the power of public health data. The next one is our Applied Epidemiology certificate. Students in this certificate gain experience accessing large public health data sets and learn how to make sense of that data. We also have an Environmental Health and Communities certificate for our online program. Students in this program will gain the skills needed to protect the health of diverse communities, promote social justice and social and environmental justice, and understand the role of race and environmental racism in public health contexts. We also have a Health Behavior and Health Equity certificate. Students in this certificate will gain skills for developing and evaluating health promotion programs aimed at reducing health inequities and improving population health. We have a Healthcare Accounting and Finance certificate. Students will be provided an understanding of how healthcare organizations operate and are managed, as well as a focused command of finance and accounting. Our Health Behavior Methods and Skills certificate will help students develop core research responsibilities necessary for achieving and assessing behavioral changes that are vital to conducting effective health behavior and health education interventions. Our Precision Nutrition certificate teaches students this comprehensive approach to utilizing nutrition to curb disease by analyzing and understanding individual responses to food. Our Maternal and Child Nutrition certificate provides students a foundation in maternal and child nutrition concepts. Students will gain the skills to work in public health settings that aim to advance the nutrition and health of women and children in communities. And our Public Health and Environmental Sustainability certificate, students will gain an understanding of the intersection of sustainability, environment, and health, providing them with the skills to be competitive in the 21st century health workforce. Where can you learn more about these certificates? You can learn about them on the website or on the link provided on this page and in the chat. You can also email Lisa Garber with any questions about these certificates. And now we'd like to open it up for some Q&A. If anybody has any questions about the information that we have presented today. I see one question in here asking if the program gives scholarships. Mary Beth, is that one that you are able to say anything about?
Sure. So with that being said, we would need to have an idea of what program you're interested in. So if you want to throw that in the chat, please feel free to do so and then we can answer. One thing that I can speak to generally is that most of our departments do have priority deadlines, as we mentioned earlier. The majority of those are actually about a month out. If you started an application already for our residential MPH or MHSA programs, which are administered through SOFIS, you would have already received actually a friendly reminder letting you know that we're about 30 days out earlier today. So I'll pop in the chat some refreshers around our programs and deadlines so that you can refamiliarize yourself with those. But again, you'd want to make sure that you are familiar with the priority deadlines, because that typically is what we use when we are looking at our first round of scholarship considerations. So I'll pop those links in the chat right now.
Thank you, Mary Beth.
Kathy, there's a couple people with raised hands as well.
Okay. Okay, I see one question in here. Is MPH MSW only available to apply via SOFIS? I'd appreciate it because SOFIS charges a hefty fee. The MPH programs do have to be applied through SOFIS. I don't know anything about the MSW side application. I don't know if Mary Beth, if you know anything about that.
So a couple things associated with that. In regards to dual degrees, there are instances where applicants apply to both schools at the same time. That's one option. And in that case, yes, you would need to apply via SOFIS, just as any normal applicant, as Kathy indicated earlier, making sure that you're adhering to the admission requirements for both programs you're applying to. If you already are a graduate student at the University of Michigan, then we actually have a built-in process, as some other schools and programs at the university, that actually lives outside of SOFIS, where essentially you can apply bypassing SOFIS, saving you time and money. What you would essentially do is email our recruitment and admissions team, and we would provide you with a link to the survey that's now moved to Qualtrics. So a couple different ways in which you can go about pursuing not only the social work dual, but also just dual degrees in general. And what you probably need to do is do your homework by attending sessions like these, talking to key stakeholders such as admission staff, people like Kathy, and probably in partnership with the department program coordinators, and assessing your plans to see how all of that would work to see what would make most sense. Anything else you want to add to that, Kathy? Did I miss anything?
No, I think that you got it.
Okay.
I also see a couple of people have asked about whether you can pursue a dual degree and a certificate at the same time. And so that is one that I definitely want to answer. You can pursue a dual degree and a certificate, but it's very important to understand there are counting rules for credit. And you can double count a certain number of credits, but you can never triple count credits. So generally speaking, if students decide to pursue a dual degree and a certificate, the certificate has to stand completely on its own. You have to take all of those courses, and they cannot be used towards your other 2 degrees. So it is possible, but it definitely requires planning. You need to make sure that you are speaking with your department coordinator and the advisor or coordinator at the other school to be sure that you are completely on track, and also talking to your certificate lead to make sure that you're getting in all your courses. And I would definitely suggest anybody who does decide to do a dual degree and a certificate that you make sure that you've got those double counting rules. You have an understanding of those double counting rules, and you've spoken with your coordinator and probably myself, just to make sure that we know where you're at with that. Are there any other questions? Let's see. How many additional courses do we typically need to take a certificate? Certificates are typically around 11 credits. And if you are not doing a dual degree, if you're doing a degree and a certificate, you can double count some credits in there. But you are limited to no more than half of the certificate. So you would only be able to double count, 5 or 6 credits, depending on how many credits the certificate is. But that is typically how many credits a certificate is. Mary Beth, there's a question about the reflective essay.
Yeah, so I'm putting the link right now in the chat. Please feel free to take a look at this page. It provides a comprehensive overview of all of the application requirements that are necessary to complete your SOFIS application. In addition, a couple other applications too, but primarily the reflective essay is associated with the application for our residential MPH and MHSA applicants. With that being said, We want to make sure that you fulfill all of these requirements and that your application is complete prior to December 1st, again, to ensure that you are considered for our priority deadline in our first round of scholarships. One thing to note is that we do need to have all application requirements completed and in our hands before we can move on to distribution to your department or program for review. So that's another thing to note as well. Talking specifically about the essays, there are 2 essays that are required. The first, as noted, is the SOFA Statement of Purpose and Objectives. This is the longer of the 2 essays, about 1,500 words. And within that essay, we essentially want to get to know more about you. This is one of the only parts where your voice truly comes through. And we want to know how you found public health. Where do you see yourself in the future, and how will this program get you to where you want to be? Talking specifically about any research or any faculty who we would like to partner with is also something that we like to see if that is applicable to your specific situation. With the reflective essay, that's the shorter of the 2, and that has a couple different prompts associated with it. This was actually created a few years ago when we continued to run into applicants who had concerns about specific areas of their application. So for instance, if you feel like you are lacking experience in a specific area, or you have a low GPA, those are just a couple examples. We want you to speak to those specific instances and reasons within this reflective essay so that we have an idea of what has transpired, what has brought us to today. We really invite you to be authentic and be honest in that so that faculty know the truth and that they're not reading between the lines and trying to interpret based on your academic history or what you're saying. We want to hear from you firsthand, and faculty know that that's where they need to go for that information. So that's a little bit more specific about those 2 required essays. And if you have additional questions, please let us know. I do see a second part to that question about the standardized test requirement. So just for the group, we have eliminated that requirement for all graduate degree programs for fall 2022 applicants. So they will not be taken into consideration at all. So no, but that is not a part of our review process this year.
Mary Beth, there's a question about the word limit on the personal statement.
Sure. So there are some word limits in there. With the SOFA Statement of Purpose, about 1,500 words. If you are running into issues, we definitely would encourage you to partner with us, and we can provide some tips and tricks in terms of how to get it down and how to work within the SOFA system. We do recognize that there are certain obstacles that sometimes do come up because the system is built the way it is, and we have specific things that are in there. So if you are running into trouble, feel free to lean on us, but also there is a SOFA team, customer service team that is very robust and staffed during business hours 8 to 5. You can also chat them. So please feel free to reach out to them as well. And if you do go over, certainly that's okay, as long as you're still able to fit it within that space again.
I see a question from Ernest. Can this be done online? Can you clarify what you're asking can be done online? Both degrees. So it would depend on what degrees you're asking about. The dual degrees I spoke about are residential degrees. So those would not be online degrees. We do have an online MPH and an online MS in Population and Health Sciences through the School of Public Health, and those are fully online degrees. But at this time, you are not able to do a dual degree with the online degree, to my knowledge. Is that correct, Mary Beth? Okay.
And one other thing that I will note, I did just put a link to our online master's degrees, again, both of those being fully online. At this time, the MPH is only for domestic applicants. And if you do have specific questions about that, you can always reach out to our team. I'll again put our contact information in the chat. Sure. So in regards to the question about decisions, that would depend on the department or program that you're in. So if you wanted to share what department you're applying to, please feel free to do that. So health behavior, health education, I can bring that up. So a couple things just to note in regards to that workflow. One being that once you are loaded into our system after your application goes through the verification process, moving from SOFIS to MPathways, which is our internal tracking system, you will receive a friend account email from the university that's automated overnight that essentially allows you to get notification that your application is with us and at the School of Public Health. We would encourage you to thoroughly review that communication because it does have a number of tips and tricks associated with the process and monitoring your application. Secondly, once your application is complete, you can check that status via the friend account and those instructions there, but you also will be receiving a communication from our team letting you know that the application that you submitted is complete. And with that being said, there will be a new communication that will be generated this year, and it will let you know specifically when the department or program you're applying to will start reviewing applications. So bringing up that document right now, health behavior, health education plans to start reviewing in December. And once review commences, an admission decision will be communicated via email within 4 to 6 weeks. And if you do have specific questions about that, please let us know. Well, if there aren't any more questions, just as a reminder, you can always reach out to Kathy and Mike via the registrar email address, and then also our recruitment and admissions team at that email address. We recognize that it's a very busy time for everybody, no matter what walk of life you're in right now, but know that we are here to support you, and we hope that you will continue to lean on us as you work to complete your application. I do see a question here. Morris, in regards to a PhD in epidemiology, Nancy Francis is the staff member who you'll want to reach out to, and here's her contact information. So it looks like there was a question here about examples of alums who found their dual degree helpful.
I don't have any direct examples of alums that I don't have any exact examples. However, if you want to reach out to the sph.registrar email and provide the dual degree that you're interested in, I could connect you with that department and see if we can connect you with some alums about it.
I'll also throw in the chat some information on how you can connect with our current student admissions ambassadors too.
And somebody else asked if they can change their degree to dual after admission. Do you want to speak a little on that, Mary Beth, or would you like me to?
So a couple things associated with that. So in terms of your actual degree, when you add a dual, you're not necessarily changing your degree. There are instances where students will start a graduate program and then elect to add a dual. And I talked a little bit about that a bit ago in regards to being able to bypass some of our robust application systems to save time and money. So that's like one instance, but there also are instances where, and we haven't, I don't believe, mentioned this yet, Kathy, but there are instances where students do duals across departments as well. And Kathy can speak more formally about the interworkings of that. But there are, some obvious like flexibilities in terms of adding the dual, but in general, especially with the certificates too, it's a good idea to kind of have a plan in place once you start, because there's a lot of formulation that needs to happen to create this puzzle and this curriculum that will work for you so that you can make sure that you're using, your time wisely and your investment. We recognize that there is a huge cost factor and life factor when pursuing graduate degree experiences. So we want you to be mindful of that, and it's better to know sooner rather than later in regards to your interests. And Kathy, I'll let you add whatever else you want to add.
Yeah, I would echo what Mary Beth just said. One of the most important things if you're going to pursue a dual degree or a certificate or both is planning. It's very, very important that you have open dialogue with your program coordinator here at the School of Public Health. If you're going to pursue 2 public health degrees, which was what Mary Beth was just discussing, that you need to make sure that you're speaking to both program coordinators, because it really is a puzzle to make sure that you can get all of your requirements in on time, and then you can graduate on time, because the entire purpose of the dual degree is to help expedite that process for you. But in order to actually expedite the process, it's very important that you plan and you just have a continuously open dialogue with all of your advisors or coordinators to just make sure you're on track. And I also suggest, if you're going to be double counting, to figure out what courses you think you're going to want to double count, and check those again with your coordinator or advisors, just to be sure that everything, your plan looks doable to them.
So I see a couple additional questions here. So does generally speaking, does this complicate the admissions process? So no, I wouldn't say it does. I think, as Kathy and I kind of just touched on, definitely planning is key. Secondly, I would say, just as a reminder, you're essentially applying to whether it's 2 departments or 2 schools and programs, just as a normal applicant. So again, doing your homework, making sure that you're talking to folks in key roles like the registrar and the admissions and recruitment folks is really important, because again, you're going to need to meet those requirements just as a normal applicant. So I see another question here in regards to the ongoing pandemic. Are all classes back to being in person, or are there some taking place online? Kathy, do you want to start that, or would you like?
Yeah, yep, I can definitely start that. We are, I would say that we are mostly back to having classes in person, with some exceptions right now. To some of our larger lecture courses are held remotely, but the vast majority of our classes will be held in person. We have a lot of safety mitigation in place. We have 3-foot distancing in our classrooms for this current academic year, and masking in all classrooms, and increased cleaning protocols throughout our buildings as well. So yes, I would say that we are mostly back in person, with a very small number of large lectures that are online.
And with that being said, we're doing the best we can to make sure that we are keeping our students, our staff, and our faculty safe. From the onset of the pandemic, much was unknown to all. But as a university and as a school of public health and a leader within this field, we have made informed decisions based on the fact of keeping our community safe. And we'll continue to do that no matter what twists and turns the pandemic continues to take. So please know that as an incoming student, as an admitted student, we will keep you informed of those changes on a very regular basis. So it looks like there's another question here. Certificate courses for international students, are they residential? If yes, does that impact my visa approval? So the certificates that we just highlighted, we talked about a batch of them for specifically our residential audience, and then one specifically for the MPH online students. Again, international students are not eligible for the online MPH program at this time. So essentially, when talking about the international student population, we would be talking about our residential 6 certificate programs that Mike touched on earlier. That does not impact your visa. Again, with the idea that, knowing your plan and starting out in the fall, being able to talk to those faculty leads and attend those information sessions, it will set you off on the right track in terms of time and money. Anything else you guys want to add to that one? Okay. So I see a question here in regards to tuition for the online program. So I'll throw that in the chat. Is there anything, Kathy, based on your experience, or Mike, that you guys want to talk about in terms of how it breaks down for certificates or just even duals in general?
Yeah, so generally speaking, the certificate isn't going to add tuition for you, because if you're already attending full-time, for our graduate students, we have a full-time flat rate. So if the way that the certificates are sort of built in, they are built in a way where you will not be adding additional costs to your degree, because you'll be taking them at the same time that you're pursuing your degree program, and you are likely going to be full-time in your degree program already. So that would not incur additional tuition for you.
I see another question here. How would you declare intent for a certificate for the online MPH?
So the online MPH certificates are done a little bit differently. They're more of an elective series than declaring intent for them. So if you finish the elective series, then you would have that that certificate added at the end to your degree. And if you have any questions specifically about the online certificate offerings, Lisa Garber is the online program manager, and she would have the best information for you about how the online certificates work with the online degree program.
And I'll go ahead and put her information in the chat again. If you do have additional questions, please feel free to pop them in the chat. We're happy to take them. So it looks like there's a question. Can I manage my funding on my own by working for on-campus jobs or RA positions? I am unable to afford it. So with that being said, we definitely recognize that cost is a big factor when pursuing a graduate program. In addition, we do have quite a large portion of our student population working. Of course, that looks a little bit different to everybody depending on your specific situation. But I would say generally anywhere from 10 to 20, 30 hours a week. You know, of course, some of that, if you're working more, probably on the weekends or at nights or during different hours, not during classes, which for our residential program typically are offered Monday through Friday during typical business hours. There are plenty of on-campus as well as local community opportunities, and I'm happy to put more information about those in the chat for you to review. Anything else we want to mention before we sign off today?
I don't have any additional information unless anybody has more questions.
Well, thank you all for coming. It was nice to meet you and have such an engaged group. Please continue to let us know if you have questions. In regards to specific admission rates, those vary across degree program and department, as well as the strength of the applicant pool, which changes from year to year as well. Generally speaking, admitted students, we typically see anywhere from about 30 to 60%. But overall, the review lens that we use at the University of Michigan School of Public Health would be holistic. When I say holistic, that kind of sense of review and that lens allows us to not focus on one particular application requirement, but to view each application as an individual and each requirement individually. So that ensures that we don't lead towards accepting or excluding anybody for one specific reason. If you do have specific questions about your situation, please feel free to let us know. We obviously get that question a lot, and there isn't a specific prescription I can give you. Another thing that I can share is that generally admitted students are above a 3.0 GPA and generally between a 3.3 and 3.5 overall. Great. Well, thank you all for your engagement and your interest in our community today. We were really excited to share information about our dual degrees and our certificates, and we hope that you continue to reach out to us if you have questions. We hope you have a great week, and we look forward to hearing from you soon. Thank you, and take care.